Health Minister Nicola Roxon is in our Parliament House studio. Minister, good morning.
Good morning.
Minister, we'll get to the rebate in a moment, but if I could just begin with this question of broader health reform. When will the government announce its plans for national health reform?
Well, we've made quite clear that we regard this as a top priority, that it's a complex process. We commissioned the Health Reform Commission to undertake the detailed work while we were investing in significant changes for the last 2 years that we've been in government. That report was released in the middle of last year, and the Prime Minister and I have then been consulting and road testing with doctors and nurses and the public across the country for the last 6 months. In fact, we've had 103 of those consultations, more than 20 of which the Prime Minister himself attended. So we are investing a lot of time and energy in getting these solutions right. I've nearly completed now some bilateral discussions with each of the Premiers and Chief Ministers, and we'll be releasing a national plan soon. But it's not correct to say that our timelines have come and gone. We have been making significant changes, investments, and seen some headway in working cooperatively with the states for the last 2 years. But the major changes that are ahead of us, the major structural reforms, you will see that plan released shortly.
With respect, I think it is fair enough to say that the PM did promise that if there was no action by the states by the middle of last year, the Commonwealth would look at a takeover. The opposition says the PM is all talk and no action on this. You've had all these consultations. Could we get another election before we see any action by the government on national health reform? Will you announce it before the next election?
We certainly will, and what I am making clear is that in the last 2 years that we've been in government, we've been doing more than commissioning the reform work. That's a very important part of what we've been doing, but we've spent 2 years, for example, dealing with the neglect and legacy that Mr Abbott left us in the health system. He ripped $1 billion out of the health system. We've now increased public hospital spending by 50%. We've invested in elective surgery, pressure points like emergency departments, big packages through COAG for more doctors and nurses in an area, for example, where Mr Abbott kept a cap on GP places despite shortages across the country. So I don't accept that there hasn't been a lot of action to date. I do accept, and all the public I think understands this, that we have a very big task ahead of us to fundamentally restructure our health system. And I think everyone would like us to take the time to get that right. And I'm sure people understand that the Prime Minister being directly engaged in that is actually a good thing for us to make sure that the government absolutely takes a clear plan for the future, especially when the intergenerational report shows just how much costs are rising if we don't actually make some fundamental changes. So it's pretty important for us to land this properly, and we intend to do that in the first half of this year.
Could that fundamental restructure involve a Commonwealth takeover? Is that still on the table? As the Reform Commission's called for one health system, could we still see a Commonwealth takeover?
Well, we'd like to be able to negotiate one integrated health system with our state and territory colleagues, but we've made absolutely clear, and it remains on the table, that if they are not willing to be partners with us in that reform, that we would take to the public the question of whether we should take over the full funding and policy settings for our whole health and hospital system. But
so could we have a referendum question on that at the next election?
Well, we certainly could, but we believe, and we've always made clear that our preference is to do this cooperatively. That may not be possible, and if that's not possible, then it will go to the public because this would be a fundamental change in the balance of state and Commonwealth relations.
The federal government is going to try once more to push its means test of a 30% private health insurance rebate through the Parliament. The opposition says it will block the legislation for a second time. Here's Opposition Leader Tony Abbott on this.
I'm against playing the class war card. I'm against the politics of envy, and I'm in favour of choice. And the government's attempt to means test the private health insurance rebate is an absolute breach of an election promise. And Labor has been guilty of a real con job on the Australian people.
A breach of promise and the politics of envy. Why are you so determined on this? Billionaires get Medicare. Why not the private health insurance rebate?
Well, we made quite clear that the global financial crisis did mean that we had to reassess a number of our policy commitments. We were quite open about it. And I think that when you then add another layer, like the information that's in the intergenerational report that was released yesterday, is that rising health costs are a huge issue for the community and for our budget arrangements. If we want to keep a good, universal, strong system like Medicare, which the government does, we need to be able to make some strategic decisions, fair changes that keep the budget sustainable for the future. And we think that one of the good places to start is that those people on very high incomes who can afford to have private health insurance without government assistance should be asked to do so.
It's a tricky balancing act, though, isn't it? Because the critics of this move suggest that it could weaken the public health system, could see the public health system swamped as people move out of private health insurance. And if we are going to have this pressure on our health system, they're not going to be able to cope with much more.
Well, the critics, let's actually name them, are pretty few and far between. They're the Liberal Party and they're the health insurers themselves. Everybody else understands that this is change which will have a minimal impact in terms of health insurance participation rates and a very minimal impact in terms of public hospitals, because it's not the rebate that is holding families that already earn $250,000 a year into private health insurance. And all the other settings, the Medicare levy surcharge, the lifetime health cover, remain in place. So I reject that, and we are absolutely convinced about the need to keep the rebate for those 8 million people that will be totally unaffected. We think it's right to support people that are on lower incomes to be able to have that choice. But I don't think that taxi drivers or secretaries or nurses should pay for me to have private health insurance, or Mr Abbott or Mr Turnbull. And ultimately that's where the fault lines will be, because this is hundreds, tens of billions of dollars of expenditure that we can use elsewhere in the health system. And ultimately we have to make these choices, and we think it's a fair one to make.